of the biggest misconceptions there is about anesthesia is that anesthesia stops the pain during surgery. I'm Dr. Hassan, board certified trauma anesthesiologist. Today we're going to talk about that misconception, what it means for your body when you're about to go in for surgery.
Or anything like me, you want to lower your blood pressure. 3 heart conditions that when
I'm going to be 100% honest with you.
the big boys think they're, hey, listen to me for a second.
Now, if you're going in for surgery, if you're scheduled to have surgery, if you're thinking about having surgery, you're going to want to save this video, share it with anybody else who's having surgery. This is what you need to know. Anytime you go in for surgery, you have to understand that your body is going through a stress test. What do I mean by this? Well, the biggest misconception is that when you're under anesthesia, your body doesn't feel pain. In reality, your body still feels pain. The only thing is the receptors that process that pain and send it to your brain, those get blocked or numbed. So when the surgeon makes an incision, when they're moving around stuff inside of your body feels pain. The anesthesia meds that we give you that are specifically pain meds, like fentanyl and Dilaudid, those help with the pain. Your body's still releasing that adrenaline and it increases your heart rate, causes your muscles to contract, causes your breathing to increase. This means your body is effectively going through what we call as a stress test. Now, what does this mean for you? Well, if you're going into surgery, you want to have your body optimized. What do I mean by that? It means that you want to prep as if you're running a marathon. Because for that duration of 2 hours or 3 hours or 1 hour or 8 hours, your body's going to be running a marathon, but your brain is not going to be awake to understand it. This means that the oxygen consumption, the amount of oxygen that your heart needs, and the ability to push that oxygen throughout your body is going to determine how well you do during surgery and after surgery. So what does this mean for you? Well, if you have health conditions like heart failure, that increases your risk because you're going to have to go through a stress test. Obviously, there's not much you can do before surgery if you have heart failure, but if you have reversible conditions, if you have diabetes and you don't eat well, if you can eat better before your surgery, this is going to help you during your surgery. But what does that mean to you? When you're having surgery, it means that your body is going to go through a stress test. There is inherent risk associated with that. If you're not a healthy person and you're undergoing a 5-hour back surgery or a 6-hour back surgery, you have to understand that your heart is going to be put through a stress test during that surgery. Now, for 99% of people, that is absolutely fine. But for that 1%, that's when the anesthesiologist needed, and we need to give medications to increase your heart rate, decrease your heart rate, increase your blood pressure, decrease your blood pressure, manage all your bodily functions, your vital organs during the surgery and get you through it. So what's my take-home message from this? My take-home message is that you have to understand your health. If you can optimize yourself before surgery, then do it. If you can't, obviously do what's safe. You need to follow your physician's orders at all times. Don't listen to a guy on the internet. But if you can optimize your body, do it. Absolutely do it, because it's your life. You only get one shot at it.